Hello, everyone. If you can hear me, please type it in the chat box so I know that my sound is working. Great. Thank you all for attending our Dental and Vision for Retirees webinar. We'll start with a pre-recorded overview. Your microphones will be muted during the presentation, but feel free to type any immediate questions you have. Our representatives are here to help. After the presentation, you'll be able to hear your questions answered by our representatives. Let's get started. Jessica, if you're there, for some reason my sound isn't letting me include it. It won't letting me share my sound for some reason. Sorry, everyone. Just having a little technical difficulty here.
I am sharing.
Oh, okay. I'm able to, I got it.
You do?
Yes, it just worked just now. Thank you. Sorry about that, everyone. All right, here's playing now.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the eBenefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SFHSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SFHSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Hi, I'm Morgan, and I want to thank you for taking the time to learn more about your benefit offering through VSP Vision Care. With VSP, our goal is to help you see well and be well for a lifetime of good vision. Let's take a look at the great vision benefits available to you. We understand you've got a lot of choices to make during open enrollment, so we'll make this simple. Why enroll in a vision plan with VSP? First, vision care is essential. Signs of over 270 health conditions can be detected during an eye exam, so it's important it's on your wellness checklist. You get savings that really stack up. Great everyday savings on eye care and eyewear, plus loads of extras so you can save all year long. You can choose high-quality care from our huge network of private practice and retail chain locations. Plus, you can shop online on Iconic, founded by doctors focused on you. Your well-being is at the core of everything we do. On the last slide, we mentioned that vision care is essential. Why is that? It's the only non-invasive way to view your blood vessels. That's how your eye doctor can detect over 270 health conditions during an eye exam. And in some cases, like diabetes, an eye doctor can be the first to detect certain conditions like diabetes, HCMS study. Even if you don't wear glasses now, your vision can change from year to year. Vision care is an easy way to keep you and your family healthy, so make sure it's on your wellness checklist. So now we know why vision care is so important. Let's take a look at how, as a not-for-profit company, VSP makes it affordable for you. With your benefit, you get great everyday savings on eye care and eyewear. So, what kind of savings does that add up to? VSP members save an annual average of $471. Check out your member benefits summary for details. So, now we know why vision care is so important. Let's take a look at how, as a not-for-profit company, VSP makes it affordable for you. With your benefit, you get great everyday savings on eye care and eyewear. So, what kind of savings does that add up to? VSP members save an annual average of $471. Check out your member benefits summary for details. You can opt for lens enhancements like anti-glare to reduce blue light impact or progressive lenses so you can see near or far. Check out your member benefits summary for details. You can opt for lens enhancements like anti-glare to reduce blue light impact or progressive lenses so you can see near or far. Check out your member benefits summary for details. Retinal screening is a quick scan that shows images of the inside of the eye. It can be used to detect disease as a baseline of a healthy eye. Compare year after year to detect even subtle changes. With your VSP coverage, you get a retinal screening each year for no more than $39, and members with diabetes receive a retinal screening fully covered each year. With VSP Light Care, it's easy to defend your eyes from the sun's ultraviolet rays or from blue light from screens, and you don't even need a prescription. Simply visit your VSP network doctor and choose ready-made blue light filtering glasses or sunglasses. This is an especially good option for parents with children who don't need corrective lenses. With essential medical eye care, here's what's covered. Fully covered retinal screening for members with diabetes who do not have diabetic eye disease. Exams and services to treat immediate issues like pink eye and sudden changes in vision. Treatment options to monitor ongoing conditions such as dry eye, diabetic eye disease, glaucoma, and more. This coverage is supplementary, and in most cases, your health insurance will be billed first. You may be able to coordinate with your VSP benefits in order to help reduce out-of-pocket costs. If your VSP doctor doesn't participate with your medical insurance plan, VSP has you covered with only the cost of your copay. You've seen the everyday savings has built your VSP plan. Now, let's take a look at ways you can stack your savings. How about an extra $20 to save on featured frame brands? 50% off additional pairs of glasses and sunglasses at VisionWorks. Prefer to shop online? VSP members save an average of $250 at Iconic, plus free shipping and returns. Plus, VSP members have access to exclusive member extras, like 60% off a pair of hearing aids from True Hearing, and so much more. VSP was founded by doctors. That's why we make it so easy to find one that's right for you. With thousands of private practice doctors and over 700 VisionWorks retail locations nationwide, getting the most out of your benefits is easy at a VSP Premier Edge location. Your benefits go further when you visit a Premier Edge location, with access to exclusive rebates and offers such as Premier Edge Promise, a worry-free eyewear guarantee, exclusive offers and savings, and advanced exam technology including digital retinal imaging and more. And if you prefer to shop online, you can choose from a variety of well-known name brands and contact lenses. Choose from over 70 eyewear brands and over 1,600 styles. Iconic is a VSP-owned company and the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your Vision benefits, you see savings in real time. As a VSP-owned company, Iconic is the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your Vision benefits, you see savings in real time. Save time and money on quality eyewear with a few easy clicks. 1. Connect your Vision insurance. 2. Select your product. 3. Upload your prescription or provide your doctor's contact information, and we'll take care of the rest. Iconic offers a variety of well-known name brands and contact lenses. Choose from over 70 eyewear brands and over 1,600 styles. We understand that choosing a doctor is a personal decision, so we've made it easy to find the right care for you. Simply navigate to find a doctor on VSP.com. Enter the preferences that are meaningful to you. Can mention a few depending on who you're talking to. You can even use the slider to search by distance and view your choice on a map so it's easy to see how quickly you can get to each location. We also get you're busy, so we've put everything you need in one place. Your personalized dashboard on VSP.com. Before your doctor visit, view your benefit and check out special offers. After, you can view your claim and even download your Vision savings statement to see how much you saved. You can even take a diabetes risk assessment. And it's easy to toggle back and forth between family members with the Switch Member feature next to your name. VSP helps you see well and be well with the coverage and quality care you deserve. Enroll today by calling VSP Member Services or by visiting us online at VSP.com.
Here's how your Delta dental plans will help you shine. Released in 2000, the first ever Surgeon General report on oral health emphasized the importance of oral health to overall wellness. The terms oral health and general health should not be interpreted as separate entities. Oral health is integral to general health. Oral health means more than healthy teeth, and you cannot be healthy without oral health. We now know that the mouth serves as a mirror, showing us information about other parts of our body like systemic disease and cancer. This visual shows all the ways that our oral health can affect our overall health. Poor gum health and tooth loss can increase your risk for a variety of chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of preterm birth, as well as low birth weight and other pregnancy complications. Oral health can even affect your mental health. Oral health issues such as untreated cavities and tooth loss may result in serious mental health issues, including depression, social anxiety, and low self-esteem. There are plan features that are here to assist with maintaining good oral health. On the DHMO plan, low to no-cost copayments. On the PPO plan, diagnostic and preventive maximum waiver and SmileWay benefits that we will highlight in the presentation. Now let's take some time to go over your plan options. Let's go over the DeltaCare USA plan first. The DeltaCare USA plan offers many advantages, including most covered services at a no-cost or low-cost copayment to the member, no annual maximum, no deductible, no claim forms to fill out, predictable costs as your benefits guide shows all covered services and what your copayment is for those services. Getting started with DeltaCare USA is easy. Go online to look up DeltaCare USA providers. Then visit any DeltaCare USA general dentist that is accepting new patients. When your dentist files a qualifying claim, you will be added to their roster and they will become your assigned DeltaCare USA dentist for any future appointments. You must visit this dentist for future visits to receive benefits. You can change your general dentist by contacting Delta Dental by phone or through your online account. Provider changes made between the 1st and 15th of the month are effective immediately. Provider changes made on or after the 16th of the month are effective the 1st of the following month. When you visit the dentist, you don't need to bring an ID card to receive treatment. Just provide the dental office with your name, social security number, or enrollee ID, and your date of birth. Your dentist will work directly with us to complete any necessary paperwork, so you don't need to worry about any claim forms. Just pay your copayment if you have one at the time of treatment. Read your plan booklet to learn more about covered procedures and copayment amounts. Specialty care is available with a referral from your primary care dentist. For out-of-area emergency care, if you need urgent care and are away from your primary care dentist, DeltaCare USA provides a limited allowance for care. A few details to keep in mind. You will be required to pay for treatment and request reimbursement. Refer to your plan booklet for specific coverage details and procedures. Let's take a quick look at some of the covered services and copayments. As you can see, there are no deductibles to meet and no annual maximum. We have highlighted some of the more common dental procedures and their copayments. Here is a look at the orthodontic coverage for children and adults, which includes all phases of ortho treatment, pre and post records, tooth extractions, and coverage for ortho progress in treatment. It also shows you the startup fee. Now let's take some time to get to know your Delta Dental PPO plan. Maximize your savings with a PPO dentist. Get the most value from the PPO plan by choosing a Delta Dental PPO dentist. You do have the flexibility to see any licensed dentist. You can visit any licensed dentist and receive coverage. You won't be charged more than your expected share. PPO network dentists agree to set fees. This means you won't be balance billed. You won't be charged more than your expected part of the bill. Here is a glance at your PPO benefits. You have no deductible. Annual maximum is $1,250 per person each calendar year, with diagnostic and preventive services waived towards the maximum. You can see there are 3 columns, all with different percentages shown. The percentage shown on the benefit sheet is the percentage that Delta will pay when a claim is incurred. As you can see, the percentage is highest when you use a PPO in-network dentist. We encourage you to use a PPO provider as they discount their fees the most. It is slightly lower when you use a premier dentist. When you stay in network and visit one of these dentists, you won't get charged more than your expected share of the bill. Using a non-Delta dentist or out-of-network dentist may result in balance billing and higher out-of-network costs. Please note that nitrous oxide and non-IV sedation are also covered on the PPO plan. You can save money with the diagnostic and preventive maximum waiver. Cleanings, x-rays, and exams fall under this category. When receiving those services, they are waived from your annual maximum, saving your benefit dollars. This slide is an example. If you went to the dentist and had an oral exam, x-rays, and cleaning, and the treatment cost was $350. With the diagnostic and preventive maximum waiver, your annual maximum does not go down to $900. It is still $1,250 for the year to be used on other services. Your plan includes the SmileWay Wellness benefit, which offers enhanced coverage for higher risk enrollees. The health of teeth and gums is tied to overall wellness. Gum disease and tooth decay are associated with a number of systemic and enrollees with medical chronic conditions may benefit from additional teeth and gum cleanings. Delta Dental PPO enrollees can take advantage of expanded coverage if they've been diagnosed with the conditions listed on this slide. Members can self-report via their online account, and it's entirely confidential. To summarize, let's take a quick look at the differences between the PPO plan and the DeltaCare DHMO plan. In choosing a dentist, PPO plan, you can visit any licensed dentist, but we do encourage you to use a PPO provider for greater savings. DeltaCare USA plan, you do have to seek services from your primary care dentist. The PPO plan has an annual maximum, where the diagnostic and preventive services do not count towards that maximum. On the DeltaCare USA plan, there is no annual maximum or deductibles. On the PPO plan, covered services are paid at a percentage. Delta pays a percentage of the services, member pays a percentage. On the HMO plan, all of the covered services have preset payments, which are low cost or no cost. On the PPO plan, there is no referral needed to visit a specialist. On the DeltaCare USA plan, you do have to go through your primary care provider to coordinate coverage for a specialist. And for the PPO plan, the dentist will file a claim form for you if they are in network. If they're out of network, you may have to submit the claim. And on the DeltaCare USA HMO plan, there are generally no claim forms to file. We do encourage you to visit your customized website, deltadentalins.com/CCSF, for a myriad of things you can do. Our website has a wealth of information that you can access without logging in. Search for a nearby dentist in your plan's network. Be sure to choose your plan in the drop-down menu, either PPO or DeltaCare USA for the DHMO plan. You can find answers to common questions about dental care and managing costs in our enrollee support guide. Find extensive dental health and wellness information on our website. And you can also sign up for Grin, which is our free dental health magazine that would come to your email inbox quarterly. While you don't need an ID card, if you do want one, you can log in and print your own. As a Delta Dental member, you are eligible for these member perks. Virtual Dentistry, which is a video-based platform that allows you to speak with a dentist live on your phone or device. BrushSmart is a discount program on Philips and Oral-B oral healthcare products. You can also get discounts on hearing aids through Amplifon and LASIK through QualSight. Life Perks, which gives you instant access to offers from a rotating group of merchants. You'll also receive emails that let you know about the newest discounts. And wellness resources, which include online articles, recipes, videos, and more. Scan the QR code for instant access or use the URL listed here. We do invite you to socialize with us on our social media sites where we offer up-to-date dental information and wellness tips. We thank you for your time and we're pleased to take your questions.
Welcome. My name is Monica Andrade, and today I will be discussing your dental plan options through United Healthcare. Your employer offers 2 different plans and a range of services from routine checkups, cleanings, to advanced procedures, ensuring you receive the best care possible. With flexible options and affordable rates, maintaining your dental health has never been easier. With the Direct Compensation Dental Plan, you have the freedom to see any dentist in our statewide network without having to choose a primary care dentist in advance. Of course, a primary care dentist can be helpful guiding and managing your oral health. So you may want to choose one anyway, or see if your regular dentist is in the network and that there is one near you in your preferred area. If you need to see a network specialist, you'll just need a referral from your dentist or contacting United Healthcare Customer Service Department. The plan is designed to fit your life in other ways too. You have no deductibles or annual spending limits, just a fixed copay for covered services and treatments. Coverage for hundreds of different dental services like crowns, braces, and silver fillings. Plus, we also have oral cancer screenings for adults 18 and older, and extra dental visits during pregnancy and the first 3 months after giving birth. Finally, preventative care is most often covered at 100% in the network with a zero copay. The oral cancer screenings just mentioned, for instance, are covered as well as preventative care. Remember that if you decide to see a dentist who's not in our network, it won't be covered by your plan, so it's a good idea to stay in the network. Who's eligible? Employees and retirees, along with their eligible dependents that would include their spouse, domestic partner, and children up to the age of 26. It's easy to let regular dental exams slip through the cracks when life gets busy, but they're crucial for maintaining your overall health. Explore your dental care options to find the best fit for you. Embrace retirement with a confident smile and discover what you've been missing. Prioritize your dental health by learning about your options so you can keep your smile bright and your life healthy. Good oral health may be linked to reducing the costs and complications of many high-risk, costly conditions such as diabetes, heart, and kidney disease. Our whole person approach is designed to link medical and dental data to help close gaps in dental care for employees with chronic conditions, with the goal of helping improve overall health and lower costs. Gaps in oral care are characterized as a lack of oral health care received within the previous 6 months, as well as the type of oral health care being received. For example, have you been able to get the appropriate periodontal and preventative care for your condition? We can help you identify closing those dental care gaps that may help you achieve better health and save money. Now we would like to discuss condition-specific data. Diabetes. People with diabetes are more likely to have gum disease. If left untreated, this can make it difficult for them to stabilize their blood sugar. However, those who receive gum disease treatment may see a positive impact on their blood sugar levels. Heart health. People with gum disease are nearly twice as likely to have heart disease. Pregnancy. Gum disease in pregnant women may be linked to complications such as preterm birth and low birth weight. Asthma. Employees taking asthma medication may be at risk of cavities, dental erosion, and periodontal diseases. Kidney disease. Treating gum diseases helps reduce inflammation, which can help reduce the risk of kidney failure. COPD. Periodontal disease may increase the risk for respiratory disease. We address individual needs with a whole person approach that includes both preventative and at-risk outreach. 90% of targeted employees were successfully reached by phone and/or mail. Preventative care includes wellness benefits covered at 100% in the network, 2 routine checkups every year, extra cleanings and treatments for expectant mothers, annual oral cancer screenings for covered adults ages 18 and up. We help at-risk employees through enhanced benefits that provide additional preventative and periodontal benefits, including expanded coverage for pregnant employees. Our dental activation combines medical and dental data to help identify at-risk employees and assess whether they're getting dental care to manage their condition. The timely interventions also encourage employees to seek oral health care. Although many services are at no cost to you, there are some services with a copay cost. Please remember to refer to your plan summary for additional information. MyUHC.com helps make it convenient for employees to learn about and maximize their benefits. The updated look and feel to create an experience that is simpler to navigate and understand. Improve usability of content and visuals by focusing on plain language standards and clearly presented information and prioritize actions. We have common navigation, look and feel across all digital assets that includes our websites and our app. With myuhc.com, employees can find a dentist, which makes it easier to locate a network provider who is nearby. You can also get health and wellness information to learn how oral health impacts overall health. Manage your claims. You can view claim history and pay a provider. Look up your benefits. See what's covered by your plan. Easy to access and print your ID cards, which is a convenient way to show proof of coverage. Use a calculator. The cost calculator will help you find what your plan pays for a procedure and what you as the employee will have to pay, and also compare local provider fees. Once you're enrolled, you'll find information and easy-to-use tools on your member website at myuhc.com and in the United Healthcare app. Together, they make it easier to get the most from your dental plan. You can find a network provider near you to go through your dental plan details, review your claims, and find answers to common dental questions. You can also download and print an ID card. With your United Healthcare plan, keeping up a dental visit is designed to be easier. Simply show your ID card when you visit your dentist. You'll be taking advantage of special network rates. Then, when you're at your visit, you'll only pay the office visit copay along with a specific copay for each covered service. Those copays will depend on your plan design. Finally, once you've had your procedure, you're all done and your claim will be submitted for you. A few points to remember. Our network provides access to board-certified dentists, ensuring top quality care without the hassle of deductibles, annual maximums, or waiting periods. You won't need to fill out claim forms for covered services, making your experience seamless. Enjoy low, predictable dental costs while benefiting from good oral health, which may help reduce the costs and complications of high-risk conditions like diabetes, heart disease, and kidney disease. We address individual needs with a whole person approach, focusing on preventative care and at-risk outreach. Our coverage is network only, ensuring you receive care from the best providers. For additional benefit information, don't forget you can also log into your yuhc.com/SFHSS website. Your 2025 benefit information will be uploaded into the portal for easy access. Additional information found on the website, remember, will be searching for a provider, digital tools to access estimated costs, your health plan ID card, and view balances with claim details. We also have wellness resources that provides free program and activities in physical health, healthy eating, stress management, and flu prevention. Ready to enroll? Review your plan materials and take the opportunity in today's session to ask benefit information that may be helpful in choosing the best option for you and your family. Thank you for allowing United Healthcare to be your trusted healthcare partner.
Okay, at this time, we're going to review some of these questions that haven't been answered. And your microphones are still muted, just FYI. There's a question here earlier from Lucy. Is there any possibility in the near future to have Delta Care USA if living in another state?
What is it, Jay?
Oh, right. So again, the question is,
Julie, could you answer
Julie?
that?
Yeah, absolutely. We'll take that feedback back internally. That is something that we take a look at each year when we're reviewing the benefit plans with the City and County of San Francisco. But I do have that feedback.
Great, thank you. There's another
And I
question.
believe in
Oh,
general, Julie, sorry, just to add to that, I believe all of our dental HMO plans are all in-state, just like our healthcare HMO plans. And so I'm not clear on those regulations, but I know there's a sort of a reason for those.
Thank you for that. Another question here from Christina. I have a large family and will be retiring in June. What would be my best option?
Jay, this is York with HSS, benefit analyst. So, Christina, you might want to sign up the retirement consultation before your retirement. So we're gonna go over with you about the dental plan, the individual dental plan, including the premium. So you're gonna make some choices at the retirement consultation. You can have the consultation since you're gonna retire in June. Maybe you can do online for 2025. Right now, we don't offer online consultation, but we do have a front counter open 9 to 1, Monday, Tuesday, Wednesday, Friday. Thursday is 10 to 1. You might want to have the consultation right after the retirement consultation. So just come down from, after your retirement consultation. So we can discuss with you all the premium and the different plan benefit.
Thank you, Yak.
Mhm.
Daniel had a question. Will Delta Dental PPO reimburse for out-of-network cleanings and x-rays, and how much?
On the PPO plan, you have the flexibility to go in network or out of network. Cleanings and x-rays are reimbursed at 100% of the cost according to the plan in place. So yes, they are. It is reimbursed, but if you step out of network, they can balance bill you the difference, and you will be responsible for paying the full cost up front and then submitting the claim for reimbursement back to Delta Dental. So just make sure you understand when you step out of network, there are differences in terms of how the claim is filed and what the dentist can charge and balance bill.
And then a follow-up question, I guess, from Lucy. Delta Care USA HMO plan is also available in other states as well. Why is it limited to just California for retirees? Yak or Julie, if you have any.
What is it? Can you
feedback.
repeat it?
Again, Delta Care USA HMO plan is also available in other states as well. Why is it only limited to just California for retirees?
I wouldn't know the answer.
I believe Jessica kind of addressed that previously. You are correct. We do have the ability to offer Delta Care outside of California. However, it appears that medical and dental benefits are available in the state of California only. So, as I mentioned, it is an option, but there is, I believe, additional reasons why the plan allows for California only.
Question with Clara. Do you have a summary comparing Delta Dental PPO and United Dental Plan? I think it's best to get one of our benefit guides, and I'll repost it here, and you could receive one mailed to you. I think that's probably the best way to compare both. Let's see. Fusako O'Hara is asking, both VSP and Delta Dental will be under Blue Shield in 2025. Yeah, can you clarify that for Fusako?
Okay, I missed the first part. What was it?
She's asking if both VSP and Delta Dental will be under the Blue Shield in 2025.
VSP and Delta Dental, they not bundle. I mean, VSP is a VSP PPO, so you need the eyeglasses, go to VSP. You never provider. If you need your dental services, go to Delta Dental. If you sign up for Delta Dental, for the Blue Shield, if you need medical services, you go to Blue Shield. I mean, 3 different things: medical, dental, vision. So depend what you need.
Right, Fusako, I'll also reply to that on your chat, and we could send you a
Okay, let me see.
benefits guide. I can do that. It better explain it.
I don't find it. Can you read it to me?
Alicia has a question. Can you offer an option in the future for out-of-network dentists that has a higher total reimbursement than 1,250?
That is the contract planning, so I will know the answer.
We do not have a plan that offers a higher reimbursement at this time. Julie, I believe the retiree maximum is 1,250 per year. Is that correct?
That is a correct statement, and they have the DMP Max waiver, so their diagnostic and preventive services do not count against their annual maximum, which does make that annual maximum about $300 more. Additionally, if they have one of the 14 chronic conditions, that would, under the Smileway Wellness benefits, that would ensure that they have those 4 cleanings, and those do not count against the annual maximum either.
Are there any additional questions at this point?
Hara Fusako?
I think we had this one. The reason I got confused is because you are mentioning the United Health combining with Delta Dental VSP in this talk. So Hara, I wanted to mention it. I see how you get confused. So for United Health, we don't offer any medical services under United Health, but we still have United Dental Services, which is a DHMO. Is in, you have to use a dentist inside the network. It's going to be only inside California. So for dental, we have 3 choices: Delta Dental PPO, Delta Care USA, DHMO, like a HMO Dental DHMO. So you have to use a dentist inside the network. You cannot go outside the network, only for California. So United Health Dental, so DHMO, you have to go to the dentist in the network. Has to be in California. That these 2 plans, the HMO 2 plan only for California. For the PPO, you can live anywhere in the United States. We don't offer any medical health under United Healthcare, but we do have dental under United Dental Plan.
Thank you, Yak. And then we have a question regarding implants. Could actually both Delta Dental and United Health explain what coverages you have for dental implants and which plan you would recommend? Julie?
Yes, I'm just pulling it up. For the Delta Dental plan, the DHMO plan does not cover implants. So if you are interested in that coverage, PPO plan would be the one that you would need to consider. Regarding, you have the the annual maximum, the $1,250 annual maximum. So that's the most the plan will pay towards it. If you can stay in network to a PPO or premier provider, they will, you'll have the higher co-insurance and they will agree to our processing policies and our fees. So that means they can't balance bill you the difference between our fee and what they charge. I would, if you go that route, we always suggest that you submit a pre-treatment estimate. That means the dental office would submit a claim to Delta Dental with the treatment plan involved, because implants are a service that requires lots of healing between the 3 specific phases. So it is possible that you could have an implant and it could go over 2 calendar years. So that would make the different services available perhaps in 2025 and then maybe 2026, because it does require healing between them. But we would suggest that you get a pre-treatment estimate so that you are not surprised and you know exactly what the treatment will cost.
Monica, can you share if
For United Healthcare, there's different types of coverage for the implants. So same thing as Julie, we can send you the sheet of the benefit summary that shows the different prices on the type of implants and what is covered for the implants, but that pre-treatment is highly recommended. So you can also take our cost sheet to your dentist so they can at least let you know what would be covered.
Thank
Thank
you,
you,
Judy,
Monica.
for asking. Thank you.
Any additional questions at this point? Please feel free to type it in.
Monica, can you verify? We have a question regarding UHC has limited providers and the coverage is half, so the patient is responsible for the rest. Is that correct? I thought it was a DHMO plan. I didn't know it was only 50% covered.
That's correct. So with the DHMO, you're not able to go out of network, so you're not paying out of pocket for out of network providers. We would only cover in-network providers. And if there is an area that seems limited and there isn't providers, we always recommend that the client sends us that zip code information. So then that way we can see if we can expand the coverage as well.
Thank you, Monica. Any other questions at this point? Going once, going twice, please go ahead and type it in. Okay, seeing no other question, that wraps up our webinar. Last question here, where to get the cost sheet?
I could paste it. Okay, one moment.
Give us 1 moment here so we can paste it on the chat. If this is
Okay.
while Yak is getting that, this is your chance
Yeah.
to get other questions in.
Yeah, that's the premium. Retiree
Thank you,
premium.
Yak. Are there any other questions at this point?
Did we
Okay.
already answer that Delta Dental? Daniel Madrid asked, will Delta Dental PPO reimburse for out-of-network cleanings and x-rays, and how much? My dentist is expensive. Julie, did you get to answer that?
I did, and I'm happy to answer it again. Again, on the PPO plan, you are able to you have freedom of choice, so you can go to an in-network provider or a non-contracted. Delta will reimburse them 100% of the co-insurance that's agreed to when you step out of network with a non-contracted provider. They're not contracted with us, and so they can charge you the difference between the accepted fee and their submitted amount. So just you know, I just want you to be that you will probably be balance billed the difference. And non-contracted providers can submit a pre-estimate as well. That way Delta can process it like a claim, although there's no date of service, and you'll know exactly what you will be owed, what you will owe.
Great, thank you for that. And I think there's a follow-up question here. Periodontal treatment comparative costs between the plans. Not sure if that is provided in our guidance. For Delta Dental, go ahead, Yak.
The cost, I think, yeah, my last link had the cost between the plan.
Yep. So the last link you provided, correct?
Yeah.
Right. Alicia stated that your reimbursement for Delta for out-of-network is very low. I got less than 50%. Julie, can you touch on that, please?
Yeah, that's happy to. That's exactly what I was saying. You can, when you step out of network, they don't agree to our processing policies or fees. So the provider can charge whatever they would like, and that difference could be costly, and it is passed on to the member. So if that's 50% less, it's a decision that you get to make whether you decide to stay in network or out of network for the services that you seek.
Okay, any additional questions at this point? Going once, going twice. Okay, seeing none, that wraps up our webinar. Again, we strongly encourage you to invite your colleagues to participate in these webinars so we can address as many questions as possible. Thank you to our representatives for sharing their knowledge on these subjects, and have a wonderful day, everyone. Thank you.
Thank you.
Thank you.